This is Module 4, COVID-19 Resource Review for Post-Acute Care Facilities. And the focus of this module is on limiting transmissions of COVID-19. My name is Laura Reichart. I'm an adult geriatric primary care nurse practitioner and the director of the Hawaii State Center for Nursing. Before we get started, I want to provide some information about the continuing nursing education program. The Hawaii State Center for Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. To receive credit for this activity, participants must complete 100% of the activity, which means watching this entire video, completing a post-test and scoring a minimum of 70%, and completing the evaluation form. The post-test and the evaluation form are accessible in a single link, and it is included on the disclosure information sheet where you accessed this video link, and the evaluation link will be underneath that. Disclosure information was posted, as I mentioned, on the module page, but just to go over some important information, no conflicts of interest were found for individuals involved in the planning or delivery of this learning activity. The Healthcare Association of Hawaii and its subsidiary, Hawaii Hospital Education and Research Foundation, is a joint provider for this activity, and in-kind support and financial support was provided by the Healthcare Association of Hawaii. By the end of this presentation, participants will be able to find the repository of the resources, identify what local and national resources are available to support post-acute care settings in limiting transmissions of COVID-19, and interpret these types of COVID-19 resources by their intended use. So where do we find this repository of information? We find it on the hah.org website or the Hawaii Center for Nursing.org website. And these are the websites for the Healthcare Association of Hawaii and the Hawaii State Center for Nursing. We together composed this document of resources and are maintaining and updating it. And so we are the parent of this document. However, all of the resources on the document are independently sourced. So let's look at what is available on these resources. We have identified a number of key issues related to COVID-19. This topic is on limiting transmissions, and I have to say that every single resource we've identified can be said to help an organization or an individual limit the transmissions. They all are really important topics that as a whole will create a safer environment. However, there's so many resources that I'm going to help you look at this document and identify some specific areas that may speak most specifically or target in particular transmission reduction. The order of the resources, as a reminder, is that federal and local government resources come first, followed by professional associations and then individual organizations. And any new document that we have identified and included in this resource since the prior version will be noted in bold. So let's look at the types of resources by their intended use. We're going to look at the facility preparation for COVID-19 clusters at the facility and limiting transmissions of infections. You can see under these resources, there are reporting requirements, guidelines for the influx of potentially infectious patients, how to evaluate patients for transfer, some more guidelines, and also recommendations for contact versus airborne precautions. This may not necessarily be a practice that is frequently utilized in certain long-term care environments. So it's always good to be reminded of the safety precautions. With limiting transmissions, you can see that there's infographics and guidance. So that's great. We can have reminders and resources. So we've sorted them specifically to that under this category. But I do want to know, and let me bring my laser pointer out, that there is also the existing communication package. And so part of limiting transmissions is having good community understanding and support of the guidelines and protocols that we are instituting in our organizations. And so we have these communication packages. We've identified resources that are available in a robust number of languages. And so those can be used as well. Let's take a look at the resource. Here we are at the resource. This is version 2, updated as of May 7th. Again, when you look at the resource online, it may have a newer or more recent version, and it'll have more information available to you than what is being reviewed today. Because this is just a review of how to use the document, of course, we want to continue to update it based off the best available and most recent information. Let's look first at the facility preparation for COVID cluster at the facility. This really has a lot of information from our government entities. There's the Centers for Medicare and Medicaid Services, CMS, as well as the Hawaii Department of Health. These letters include reporting requirements and information for waiver providers and what to do if a patient tests positive. So more detailed information and guidance related to the reporting requirements. We also have a section on what to do in the case of an influx of potentially infectious patients. Again, we have guidance from government agencies. The Centers for Disease Control provides key strategies to prepare for COVID-19 in long-term facilities and long-term facilities in nursing homes. Resources for hospitals and healthcare professionals for patients with suspected or confirmed COVID-19, and preparing nursing homes and assisted living facilities. So these are really nice documents, as you can see here. Some are videos, most are guidance. And then we have OSHA guidance for preparing workforce. And we also say, we also have professional associations. So they have some disaster planning in relation to COVID-19. And then finally, in this section, there's some checklists. So we know that policies and guidelines are great, but then we have to implement them. So these checklists are nice to make sure that you have each of the recommendations accounted for and established in your organizational plan. When this next section, evaluating patients for transfer, so we have guidance on healthcare facility transfers. If you recall, in the first module with cohorting, there is a recommendation to discharge patients who are well enough to be entered back into the community if you're a residential facility, so that you can take a patient from, for instance, long-term care. If you are a nursing home, take patients from long-term care who can be discharged to your setting so that the long-term care can receive patients from hospitals. So there's this big transfer of patients that needs to exist. And part of that consideration is if they have a COVID diagnosis and how to accommodate them. So there is guidance to the healthcare facility from the Hawaii Department of Health. Why don't we look at that document? The Hawaii Department of Health has provided summary and actionable items Transfer of all lab confirmed patients from acute to long-term care facilities should only occur when the patient is medically stable and where there are facilities which show readiness to accept. So we want organizations in the community to have good plans, advanced care planning in the event of needing to take on a COVID patient. Again, the recommendations for cohorting and social isolation within residential care facilities is to be able to create staffing and resident bubbles where their entire environment is contained. So there needs to be the ability to put people in entire units or floors or wings that are removed from everyone else. And then we have some guidelines from acute care and long-term care transfers and frequently asked questions in terms of preparation. So let's continue to look at this resource document. The American Healthcare Association and National Center for Assisted Living has guidance on admissions from and discharges to hospitals. And there's also guidance from home health and hospice agencies on admissions from and discharges to hospitals. So these are two different organizations that are focusing on admissions and discharges. However, because they are different types of facilities, we have home health, hospice, and long-term care, then you can see that there may be some different guidelines. And so depending on your organization, you can look at those documents in particular. If we look at these checklists, and let's open both of them up. These are both from the CDC. Let's just actually look at one. The healthcare professional preparedness checklist for transport and arrival of patients with confirmed or possible COVID-19. You can review all of these steps. If you're using it electronically, this is an automated checkbox. And so it does have these steps that you can go back to and say, do I have an assessment and triage of patients? Do I have optimal patient placement? So are you able to cohort them into their own bubble? Do you have policies for visitor management and exclusion? So if you're not able to check these boxes, there are resources in this document that you can go back to and look at and say, okay, so what are the guidelines for visitor management and exclusion? Or are there any canned tools that I can use? Are there letters? Are there policies that exist? And we do have them available to you. So look through the document and identify if we have identified any resources that are helpful for you. And our hope is that it is the case. These are helpful for you. And then finally, has your staff been trained? So know who, when, and how to seek evaluation by occupational health following an unprotected exposure. So we have some great training resources identified related to PPE, but then we do have a staffing module that goes over some of these staffing, reporting, and identification resources, recommendations, and guidelines that you can look to if you need to develop policies and protocols for this particular section. So these resources can be used as a self-check to identify if your organization or your unit or your floor or your home health organization or residential care facility has all of the plans in place. So if you go again to this checklist and you say, you know what, I don't have a visitor management policy. So you can go back and look at the resources we've identified and say, well, let me see what exists so that I can build one now and also for the future should there be a COVID outbreak in the fall or winter or at any other point in time. Moving back up to the table of contents, let's go to limiting transmission of infections. So these are some safety guidelines. There's some nice infographics, and I'll show you some examples here. So there's some nice infographics about safe environments, and you can use these in your facility and also for staff training, should you be leading training in your organization. There are also guidance. So guidance for infection control from CMS, again, our government, and CDC, another set of resources from the federal government. COVID treatment guidelines from the National Institutes of Health. And then we have some professional organization resources. American Healthcare Association and National Center for Assisted Living has guidance on admission from hospitals and preventing COVID-19 from entering an assisted living facility. And then we have organizations that have created policies and are sharing them. And then finally, we have screening checklists. So this is not just about the event of an admission, but also screening so you don't have an unidentified exposure. So screening for visitors and staff, and then steps to limit COVID-19 outbreaks in long-term care. So these are really important resources because we don't want COVID to enter into a post-acute care environment. We know, we've seen in other cases, in other communities, that COVID-19 can really spread rapidly. And so we really want to prevent that, that from occurring in general. So let's look at some of these resources just to see what types of resources are available to you. For home health agencies, let's look at the CDC resource for home health agencies. And this is a PDF guidance, but we've linked you, as I mentioned, to the main page so that if it gets updated, you have access to that update. So there's a summary of the memo, and then there's clear guidance for admitting and treating patients in home health, for home health agencies. So this is federal guidance for home health organizations. Now let's look at trainings and checklists. So let's look at the screening checklist. Here you can see this is a screening checklist for visitors and staff. There's also in the staffing module a screening checklist specific for staff, but this one is for both visitors and staff. And so you can have anyone who's entering the facility ask these questions. And then if, it's guidance for what, based off certain answers, and then some implications. So if you have certain questions, then you can say, well, consider implementing a universal policy, or when there are cases or sustained transmission, do these steps. And so you have this guidance here, so you don't necessarily have to create that whole policy yourself. So these are nice resources to have, particularly for smaller organizations who may not have the robust resources or the resources from, let's say, a national parent organization that's coming down to them. Let's also look at the University of Washington Medicine resource. Now, a lot of these, as a notes, are rough drafts of what they hope will be more information. But, and sorry for the scroll, but there is section 4, you can see, is specifically focused on the post-acute care and long-term care, particularly a PPE conservation policy. That's nice. And you can click on any one of these documents and they're downloadable. And then they also have information for staff, including student rotations, if you're having students on your site, and employee attestations related to symptoms. So there's some more resources here. These are really nice because they are existing policies that you can download for your organization. And then I do want to know, if we go back to the table of contents, I do want to note that the existing compilations of resources may have, and certainly will have, robust information available to you. So you can look at these and there may be additional resources or a whole new, it'll be a branch that opens you up to all these different kinds of tools. But I think it's important to recognize that a lot of other resources and repositories exist. Some that I'll point out related to limiting transmissions. The National Association of Home Care and Hospice has coronavirus products and services resource. A lot of these have been made free or of reduced cost, and the National Hospice and Palliative Care Organization as well. So these ones, if you're looking to change or enhance your organization, maybe add telehealth services, even within a residential site to enhance communication, there are, there are some compiled resources here. And these care and treatment strategies and social distancing and home disinfecting is really nice for adult residential care homes, foster homes, or home health. If they're going into the homes, they can reinforce these messages or develop the messages or policies or protocols within the organization. And then again, we need to have adherence with any of these guidelines. So these communication packages with the World Health Organization has really nice printable resources that are easily understood just by looking at the pictures. And the Asian and Pacific Islander American Health Forum has compiled a large number of resources in a variety of languages. And all of the Hawaii Department of Health resources that include our frequent or our common languages in Hawaii are included in this resource as well. And so when you implement strategies that include social distancing, even in residential settings, you can use these as reminders that are inclusive of everybody's primary or native language so that they can easily adhere to the guidelines that you have instituted. And lastly, a big part of having being able to limit transmissions is having an informed workforce. So these trainings that you are participating in will help you identify resources and tools that you can apply to your organization. But these trainings do not address the skills of proper PPE donning and doffing, or adherence to protocols, like airborne precautions or contact precautions, or other specific care considerations, triaging, specific symptom monitoring. But they exist. And so we have identified the locally developed trainings from the University of Hawaii at Manoa School of Nursing and Dental Hygiene and the University of Hawaii John A. Burns School of Medicine, as well as CDC trainings for healthcare professionals, nursing homes, assisted living facilities. And then there's robust guidance about optimizing PPE use. So it's not just about preventing the transmission from staff or visitors who may be coming to the facility, but it's also maintaining and creating that safe environment. And we know that PPE is a skill and skills need to be refreshed. So these are great resources that you can apply to your staff. You can, they are largely free and accessible. If we've posted them here, they certainly are free. And you can just run that whole module, whatever training you choose to help your staff and your healthcare providers maintain a safe environment, not just for the residents, but also for themselves. Thank you so much for your engagement. This is the end of the module on limiting transmissions. Be sure to take the final quiz and evaluation. As a reminder, this is a requirement to receive continuing nursing education credits. And there is a link that's on the information page, and it is below the link that you clicked on to access this video. Please also subscribe to the Hawaii State Center for Nursing newsletter for more information about upcoming events and continuing nursing education activities. And you can do so by registering at bit.ly/HSCN news, and that will get you to the newsletter registration page. Thank you so much, and I hope you enjoyed this learning activity.